Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center reporting for the week of May 17th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County has 88,157 confirmed COVID-19 cases and 1,688 COVID-related deaths. The infection rate is coming down nicely, and the vaccination rate is coming up nicely, with about 75% of those 16 and up with at least one dose, and about 57% of those 16 and up being fully vaccinated. And Oakland is just behind the county average with 72% of those 16 and up having one dose and 54% of those 16 and up being fully vaccinated. But we are continuing to see pretty significant disparities in vaccination status even within Oakland. For example, in 94619, the rate of fully vaccinated individuals is above the county average at 60%, while in the 94603, it's below the average at 42%. But the good news is that they are all increasing. And so therefore we are seeing increased rates of protection across the entire county. And we are hoping to see this continue to improve as we have recently received the news that Pfizer has been approved for their vaccine for young people age 12 to 15. So likely we will see the county update its website to be able to reflect this population as well, because currently on the dashboard, it is only showing the percentage of those 16 and up. And so now we have a whole new population that we'll want to include as we take a look at how we are coming along on our path towards community immunity. So the Advisory Committee for Immunization Practices met on May 12th, and they discussed and deliberated and decided to put forward a recommendation that they would approve the use of the vaccine for those 12 to 15, and they reviewed a number of matters related to this age group, including the clinical trial data. And the results look just as compelling as they do in adults, with an estimated 100% efficacy in terms of preventing hospitalization and preventing severe illness. The study for the 12 to 15-year-olds was basically added on to the study that was already conducted for 16 and up. And so they added another 2,200 participants, about 1,100 received the vaccine, and the rest received the placebo, and 660 had 2 full months of follow-up. And when they looked at the effectiveness, they not only looked at getting any COVID disease, mild or severe, or COVID deaths. They looked at that versus in the vaccine group versus the placebo group. But then they also did what they're calling an immunobridging study, where they basically were able to do some comparisons between the 12 to 15-year-old group and the 16 to 25-year-old group to draw some additional conclusions. They looked at safety of the vaccine group compared to placebo. And the biggest things that were surfaced were really around those same anticipated reactions that we saw in adults. Those also held true for children, or for 12 to 15-year-olds. And one of the things that I thought was important that they did in this meeting was take a look at some recent data about this particular age group of 12 to 15-year-olds. Um, and some of the data is actually done by 12 to 17-year-olds. A lot of the data actually looks at the 12 to 17-year-old group. And so I'll show you some of the slides that were shared. This slide here is showing basically over the past year, uh, total COVID-19 cases by age group. And as you can see with that darker orange color at the top there being the 65 and up group, is that that group was really making up a much larger proportion of cases and now has gotten smaller and smaller to where the 65 and up are now only about 8% of COVID-19 cases, which is good because as we know, that is the group that was suffering more and dying more from COVID-19. And so you can see that the uh, the blue there at the bottom, the light blue, is the 12 to 17-year-old age group. And those started out as a very small number of cases, but those are increasing. And now you can see that those are actually making up more cases than the 65 and up age group. And so we see that, and we really haven't completely reopened schools and all the activities. And so that would be anticipated that with more mixing, those cases could begin to go up. So this was one thing that they looked at to determine that there are increasing cases happening among this age group. And even more importantly, I think, is that they looked at the average rate of hospitalization. And they really were looking at 2021. And of course, in the beginning of 2021, we had that really significant wintertime surge. And so there was an increase of cases and hospitalizations and deaths just across the board. But here we're looking all at people under 17 years old. And while hospitalization rates did come down significantly, you can see that they started to go back up for the age groups of 0 to 4 and 12 to 17. And they started to go back up right about in March and are sort of headed up at this point in terms of hospitalization rate. And this is looking at hospitalization rate per 100,000 people that are in the age group. So that red line there is the 12 to 17-year-olds, and you can see it just kind of heading right up. And so this again is another compelling piece of information that lets us know that this, although children are not affected as significantly as adults, this is not benign, and some children are landing in the hospital. Now, this question comes up quite a bit, and so I thought I would share this slide that was reviewed at the ACIP meeting on May 12th. And this is taking a look at hospitalization rates for 12 to 17-year-olds for COVID-19, which is that yellow line there. And it's comparing with the flu and hospitalizations that are occurring within the flu seasons. And so, as you can see, this is really quite significant. And actually, they were looking at the H1N1 pandemic. And so, this was, comparing to sort of the last time that we had a very significant pandemic in this country. And COVID-19 is clearly surpassing by quite a bit the hospitalization rates when we compare with influenza to COVID-19. And this is specific to the 12 to 17-year-old age group. So again, this is not a benign situation for young people. So we know that children are much less likely to get severe disease or die compared to adults. So the risk is lower, but we know that it's not zero. I talked in some detail about children and how they are thought to or known to drive transmission in certain settings. And they did also review some data to that effect in the ACIP meeting that showed that adults who live in households with children who were in school were more likely to end up presenting with COVID-19 themselves. So while we hope that more of the adults and older folks are getting vaccinated and so are therefore protected, we know that that is not the case yet across the board. And so as children go back to some of their pre-pandemic activities, we want to ensure that they are not contracting COVID and bringing it back home or transmitting it to other family members who may be more vulnerable. And of course, we know that COVID-19, even if it does not kill you, it is not benign. And we are seeing long COVID, which affects children at about the same rate as it affects adults, with just a whole number of potential symptoms that can be long term. So again, not benign in this population. And then lastly is that really in order to reach herd immunity or community immunity, we will need for children to be part of that equation. And so we know that almost a quarter of the United States population is under 18, and that's the same here in California as well. So it is important that we consider children as we are thinking about what is going to take to get us to that herd immunity threshold. So at this point, the Pfizer BioNTech is available for everyone ages 12 and up. And most of the vaccination sites at this point are letting you know ahead of time what vaccinations they have available. At Roots, we have all three: the Pfizer, the Moderna, and the Johnson and Johnson. And you can register for vaccination at rootsclinic.org. And one thing to note is that at this time, parental consent is required here in California. This may vary in different counties. Here in Alameda County, parental consent is required for everyone from 12 to 17. So a parent should accompany a child who is being vaccinated. And remember that the Pfizer BioNTech is 2 doses spaced 3 weeks apart. And when you sign up for your mRNA vaccine, you really are signing up for both doses. That is important. So now I'd like to turn us to the new CDC guidance around masking or not masking. And of course, we've gotten a lot of questions and concerns about this because the CDC came out with this guidance, and I think it took a lot of people by surprise. And so it came out really without warning, and I think it's left some folks wondering what the reasoning for the timing was, and also what the impact will be from the CDC director's statements that were put out. It seems pretty simple in terms of um, her position that vaccinated people are protected and can therefore uh, do what they like without a mask on, and that unvaccinated people are not protected and they should get a vaccine. And then if they're not going to get a vaccine, they should wear a mask. And so I think the idea potentially is, and again, I'm not trying to read minds here, but I think the idea is that perhaps this would motivate people who have not yet gotten vaccinated to go ahead and do so. And I certainly hope that that will be the effect. I think that the concern about this is shared by many people in many different fields that are involved with COVID-19, and it's everything to do with the actual spread of the virus and the variants. So, sort of the epidemiology of it. To the psychology or the sociology of what will that mean? Will that mean that people who are unvaccinated will go ahead and just stop wearing the mask because they didn't really want to in the first place, that no one can really tell who's vaccinated or not vaccinated? So I think these are all very valid concerns. And I think the answer is we just really don't know what the impact of this guidance is going to be. Although I think anecdotally speaking, there are many of us who have noticed that the guard seems to be getting let down, and many people are choosing to not wear their mask. But we also know that this is something that is going to be very dependent on each individual's comfort level. I think what is a little concerning to me about the guidance is that, for one, it doesn't take into account what's going on in your local area. And I think that that is so variable across the country, that it is really hard to fathom how this could be the same guidance for everywhere. And even though certainly states and counties can, have their own guidelines which go beyond what the CDC says, I think that that just makes it so much more confusing for everyone about what it is that they're supposed to do. So I really do feel that it's still just up to each one of us to make the best decision that we can with the best information that we have. And so I'll share a little bit about what I think at this point that information is telling us. And I think what we know is that COVID-19 is able to spread in the community among unvaccinated people. So we know this already, that the more vaccinated people that we have, the less likely or able the virus is to spread around. And the less able it is to spread around, the less able it is to mutate. And so the less variants that we have to deal with. But we're not there yet where we can say that our vaccination rate is such that it's protecting the unvaccinated. The unvaccinated remain unprotected. And with the lifting of mask mandates, I think that life just got a little more dangerous for the unvaccinated. And so the couple reasons for that. One, as I said, COVID is still able to spread among the unvaccinated. Two, we still have outbreaks that are happening. They may be happening in very localized areas, or they may be happening in entire countries like India, or they may be happening in certain states. And so, anywhere where we're having surges, there is more opportunity for new mutations. And then as people travel around, those mutations get imported. And so, once again, life for the unvaccinated may have just gotten more unsafe because those same people are not now required to wear a mask. And there's really no way to tell the difference between a person who's vaccinated and unvaccinated. So essentially, if you are out among people you who are unmasked, you really don't know their vaccination status. The other thing is, and I talked about this almost every week at these briefings, is that we have been relying on layers of protection. And so, what that means is that if you are an unvaccinated person and you are around other people, they are masked and they are distanced, and you are masked, that's three layers of protection right there: their mask, the distance, and your mask. Well, with the CDC's new guidance, essentially does not require the other person to wear a mask, and it also doesn't require them to distance. And so you've really only got your mask now. So only one layer. Or you can wear a multi-layer mask or a higher filtration mask. And essentially that is what I would suggest right now, is that if you are going to need to be around other people who you don't know and whose vaccination status you don't know, you're going to want to avoid being in close proximity. You're going to want to continue to avoid crowded indoor spaces, especially those that are poorly ventilated. And you probably are going to want to shelter indoors as much as you can whenever you can. Um, and if you are going to have to go out and be around others, particularly around members of the public, you may want to consider a high filtration mask like an N95 mask that is, of course, properly fitting, because that is really what you're going to be relying on in order to not be exposed to the coronavirus. And you may want to continue to wear your eyewear as well, because remember, nothing has really changed for you if you're unvaccinated. It's true that case rates have come down, so that's a great thing, but it only takes one person, an exposure to that one person, and we still are having cases every single day that are positive, and we are seeing more contagious variants really take hold here. The West Coast variant, and to a lesser extent, we have the UK variant and the South African variant. And we know that we have more contagious variants. And so therefore, if you are remaining unvaccinated at this time, then it may be time to really step up your mask game and to really be cautious about the spaces that you are going into. Um, And so I think that the other issue is that if folks stop wearing their masks and it does begin to circulate more, COVID-19 begins to circulate more among the unvaccinated, then actually it makes it less safe for everybody. And so this is the other concern, because we're just not out of the woods. We are still in a global pandemic. And although things are looking good and heading in a good direction here in the United States, at the moment, we also know that things can change, particularly until we reach herd immunity, which we're still ways away from that. And so once you start having increases in cases, then we know that the risk of being exposed and infected becomes higher for everyone. So if you're vaccinated, then I think you can feel comfortable that you will not get severe illness or die, especially with the variants that we have currently here. The vaccine appears to be protecting quite well. But we don't know if it's still 95%, maybe a little bit less than that, maybe 90%. We don't know. We don't have clinical trials to establish that. But even at the 95%, that's still 5% chance that you get mild illness. And remember that if you then get get mild illness, you can still then transmit it to someone else. So certainly if you're vaccinated and you live in a household with unvaccinated individuals, then I would consider continuing to wear your mask despite these new guidelines. If you contract mild COVID, you will probably be fine, but you may pass it to someone who may not be fine. And so the other concern is, of course, that vulnerable people who have not gotten the vaccine or maybe are not able to get the vaccine, or even those who got the vaccine but maybe have. Maybe they're immune compromised and did not mount as good of a response with the vaccine. And we know that this can happen. And so those people are all vulnerable. 12 to 15-year-olds just barely got approved, as I've just reviewed, and those 11 years and younger are not even eligible for the vaccine yet. So those are several populations of people who are still unvaccinated. They still remain vulnerable. And so therefore, this guidance just feels a bit premature and is concerning to me from that standpoint. And so I do think that we could afford to keep the masks on for at least a little bit longer, at least until we get further towards community immunity, at least until everyone who wants to get the vaccine has had the opportunity to get the vaccine. And I think that we've developed good habits and that we really were sort of normalizing mask wearing. And I've even talked to some people who say that they like the mask, they didn't get the flu, their allergy symptoms are better, they don't mind. And I know that that's not the same for everyone. Some people are very tired of the mask and are more than ready to ditch the mask. But I think it's a good idea for us to hang on to those masks. If you are in crowded and poorly ventilated indoor environments, even if you're vaccinated, I think it's still a good idea, because who wants mild COVID? I still don't think that we really want to be catching a case of mild COVID, and we don't want to be spreading around, because the fact of the matter is that we still are in the midst of a global pandemic. And I don't want to see a situation where we took two steps forward and we're taking a step back. And so I would just encourage us to continue with the layers of protection, which are vaccination and now are for ages 12 and up, masking and spacing. We still think this is a good idea if you are around those of uncertain vaccination status. Just keep your mask on and keep the distance. It's been serving us well so far. If you get exposed, then you should get tested and quarantined. And that is if you are not vaccinated. So if you are vaccinated, and you get exposed, then it's not a bad idea to get tested, because again, there's still that percentage chance and you'll want to know so that you don't spread it around to others. But this is particularly important if you're not vaccinated. And anyone who gets COVID symptoms, whether unvaccinated or not, should go ahead and get tested for COVID-19. The layers of indoor protection are so important. And I think they just got a lot more important with this dropping of the mask mandates for vaccinated people. Um, Ventilation is so critical, and I really do hope that we are turning our attention to ventilation in all of the indoor spaces. So, fresh air circulation, the doors and windows being open, if we are relying on HVAC system, then we need proper filtration, which is a MERV 13 filter or higher, or at the very minimum, a HEPA filtration unit that is appropriate for your room size. We still also think that disinfection and sanitization is just another important layer, particularly on high touch surfaces, but also on low touch surfaces as well. And remember to take a multivitamin, take additional vitamin D supplementation, get a good night's sleep, and keep your stress levels managed. If you haven't checked in with your primary care physician in a while, please do so. Now would be a great time to check on your blood pressure, your sugar, your cholesterol, all of the routine screenings, including the cancer screenings that are appropriate for your age and gender. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10. See you then.